Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi, I thought today I'd talk to you about something a little bit more mundane, but extremely important, and it applies to pretty much everyone out there that's watching this. There's no question that practices are suffering, having difficulty because of a lot of the monetary things that are going on. And people always ask me when I consult with them, what do I do, Mitch, to make my practice work better? How do I make more money? And of course, everyone's typically afraid to talk about that when it comes to the healthcare field, and that doesn't make any sense to me. I think it's important that it is addressed and addressed appropriately. So first thing is think the biochemistry and physiology in that area. If you don't do a certain blood test, for example, and that person has that issue, then you won't address it and that person won't get healthy all the way around. I mean, that makes sense. If you're really doing only a little bit of testing, I mean, of course you can't do everything, but there is a level of being comprehensive. Like if you did a car check that you take into your typical car dealership, they're going to do, 155 check when they hook it up to their computer. It'll make sense to them, and again, they can demonstrate what areas are a problem. Well, how do we do that if we haven't done a deep enough biochemical dive? So there are also equipment that are physiologic that make sense. Now, on the same light, don't buy tons of equipment. I think people overwrought with what equipment's out there, and they go to different seminars and different types of conventions, and everyone's trying to sell you something, and they make every single thing sound like it's the best. Well, it's not necessarily true. If you're not sure how it will fit into your practice, how you will get, a return on your investment, the ROI, or where it would fit to really help you diagnose and treat someone appropriately, then don't get that piece of equipment. It would be best if you had someone you could talk to directly who can help you in that particular area, because there are so many places, so many people I consult with. I literally tell them, my goodness, why did you get that equipment? And so many are sorry. They spend hundreds of thousands of dollars to find out that it's not helpful. Also, make it your duty to get results on your patients in less than 30 days. Now, what I mean by that is if you're going to start a program with a patient, and by the way, you shouldn't start until you have everything back. I'll reiterate that in a moment. Don't start before you have everything back, because it's a recipe for failure. Know what you're dealing with. Take care of this particular area for these patients that are of problem. And if you do a deep enough dive, you do enough biochemistry look, you get the right blood test done, what I call a wellness profile that would be equivalent to going to a car dealership that did that 155-point check, the same thing, then you'll know what to do. So do try to get results, particularly within 30 days, because if the patients are paying cash for this particular visit, you're going to want them to see somewhat results. If you start too soon, you may not get the results that you're looking for and lose a patient. But if you do get results, you're sure to get someone else. And always ask if they're doing well. Are you doing great? And the patient says, yes, I really feel good. Then would you please refer me somebody that you know that really needs my help as well? And it could be a friend. I know you know someone, because so many people are sick now. That's the case, and we need to do that. So know what's going on, and it's okay to charge for your knowledge. I can't express that more. Again, healthcare practitioners are always shy of talking about money. Well, you went to school, you learned, you have a skill set that's going to help someone get healthy that others have not been able to do. So please feel free to charge them. Whether you're going to use cash, which I believe is my method, the best method other than insurance, and that is a whole seminar in itself, and I will discuss it in further things of this nature to you. But if someone's there and paying cash or insurance, you do have a right to be paid and get the information. There's no place anywhere that you go that you don't pay for someone's advice out there. And follow the adage if you can, because I've lived with this for the 44 plus years I've been a physician so far, and I think it's a great adage. Treat every patient like you would want your mom to be treated. If you'll do that, you're going to find that they will refer others in the family. Case in point, I did a consult this morning for a specific patient. The son happened to be on with that at the same time. And guess what? The son now became a patient too after listening to how I spoke to them. So don't feel uncomfortable having someone else there, a friend or family member during your consultations, because they too will become your patients. More on this to come. I think it's interesting. By the way, if you want to learn how to do this diagnostics correctly, you need to take a course in Diagnostics 360 Degrees, bringing everything together. It's not a readily available conference. It's a conference that I do for people in my office in Boca Raton, Florida. If you have interest in taking a free seminar, it's free. We even feed you breakfast, we feed you lunch. You just have to get there and find a place to stay and sleep. But if you do, it's a great opportunity for you to really learn how to take a deep dive, look at a patient from all angles. I pretty much liken it to an EKG, which is typically, a 12 lead that looks at everything, not a 2 lead, but 12 leads for a good reason, looks at the heart from a 360 degree vantage point. Let me know. You can contact me and send me a message at Dr. Mitch at MitchGhen.com. That's DRMITCH at MITCHGHEN.com. Thank you so much for watching. Always appreciate it. We'll try to do more on this soon. Thank you.